Yes, thank you everyone for inviting us today. I'm Hiedi Swift. I'm one of the Respiratory Nurse Specialists working in Mansfield, Nottinghamshire Healthcare Foundation Trust.
And I'm Sarah Atkinson. I'm Learning Disability Nurse Practitioner in PICS. So I'm employed directly by the two primary care networks in Mansfield in Nottinghamshire to do their learning disability annual health checks, flu screening, all things LD within GP surgeries. So next slide, please. So we would want to talk to you about the new COPD self-management plan that we did, but it's important to know where it all started. So I was just going to explain, it was a shared patient that we both had, so both from sort of different services. So I'll talk to you about Laura, who's 47 years old, got a learning disability and pathological demand avoidance, which is really important when I come to tell you later. She lived independently for many years, self-sufficient, but when you look back in her notes over the 2 years previous, so this was in 2022 that I met Laura, but the 2 years previous to that she'd had lots of admissions to hospital with chest pain, shortness of breath. She had a diagnosis of asthma and had inhalers, but that was really as far as any diagnosis or interventions or treatment went. And she did always have her annual health check and asthma review at a previous GP surgery, but in 2022 she moved to a residential setting in my area, from out of area into my area, and that's when I was first aware of her. So I was asked to do a home visit as a reasonable adjustment to complete her annual health check. It was a strange day. She lives in a home that's got 2 bungalows on site. It's a group home, and I was seeing someone in the first bungalow first, and there was a lot going on in Laura's bungalow that morning. Another gentleman, they'd had to call an ambulance out to see them. It was very busy, lots of things going on. So there was actually an ambulance and a first responder in that building at the time. So I almost, the health check almost never happened that day because of everything else that was happening. But luckily, because of the structure that she needs around pathological demand avoidance and a learning disability, that we felt it was important to go ahead with it despite everything else that was going on. And when I walked in to see her, she was sat at the end of a long table, and I immediately, the minute I clapped eyes on her, I was like, oh my goodness, this lady's really poorly. She had cyanosed lips, her fingernails were blue, she was quite breathless. She'd had her inhaler, but it was clear that she was very unwell. So immediately sort of jumped into action rather than the health check, but did get a SATS, and they were 77. And she was really poorly. She was talking about that she'd been unwell for 3 weeks previously, but actually she was much better at that point, shockingly. Because, and also she was absolutely adamant that I was not sending her to hospital. There was no way she was going to hospital, but because I'd got this other thing that was going on in the home that day, I'd got the first responder there who was able to check her over, do some proper SATs, do an ECG, etc. there at the time, and insisted that she went in. As a result of that, she absolutely hated me with a passion, and still does 3 years later. Absolutely hates me, even though everybody's said to when they arrived at hospital, you know, Sarah, save your life. It doesn't matter, I'm the one that sent her to hospital, and that will forever be our thing. And so when I go, she doesn't like to speak to me. She went to hospital and she was in for a few days while they were getting her sorted on antibiotics and various things. And while she was there, they did diagnose her with COPD. And she came out with an old style COPD management plan, which I'll show you in a moment, which might be familiar to some of you. And also, as a result of that, there was a referral to Hiedi as the respiratory specialist nurse. And they was born the idea really for this plan. So if you don't mind going on to the next slide. This is the plan that she was sent home with, obviously completed, but as you can see, I'm not going to go into it, but it uses a traffic light system, which is brilliant and very well recognised in learning disability services as a great way of helping people. But it's so wordy. There's no pictures there. It's very complicated. It's a lot of self-directed information. And really, you know, for people with learning disabilities, and certainly for Laura, this was not the plan for her. So referred to Heidi, who then rang me and said, is there a COPD plan in an easy read format, in an accessible format? And we did look. We'd spent quite a lot of time looking, and there wasn't. So that's where the idea came from, that we were going to have to do it ourselves, really. So I'll pass you over to Heidi on how we went about that.
So next slide, please. Thank you. So the first thing we had to look at was, in our local area, was there a need for an additional self-management plan? Previously, Tracy's touched on, you know, there's so many different plans out there. We didn't want to replicate something, and we didn't want to add anything else to what was already there. But from meeting Laura and learning about her way of learning and how she understood words, pictures, images, we felt it was really important that specific patient groups had something that they could relate to and use themselves. That was really important, that it wasn't just a plan that was given to the patient and then used by carers or used by someone else. We wanted that patient to be completely interactive with that plan and feel that they owned it. So we did a lot of searching about the figures within our immediate area, Mansfield and Ashfield. We were looking at registers, COPD registers, but also with a code for COPD and a code for learning disability at the same time. And we found in our local area that we had 95 patients with both codes on their records. We then looked a bit wider and thought, it's okay focusing on our own area, but what would the impact have if we went a little bit wider? So we looked across Nottinghamshire, used the same codes, and we found just over 1,500 patients with a diagnosis of a learning disability and COPD. What it was important to note was that these figures don't include learning difficulties, poor literacy, language barriers or dementia. So we also thought, on the back of developing this plan, maybe we could make it more inclusive and wider, and could we target a lot more patients using this. And as Tracy's already touched on the leader report, there's 24% of learning disability deaths are from respiratory disease. So we felt in ourselves, yeah, it probably is worth developing a new plan. Next slide, please. Thank you. So what did we need to consider? Number one was it worth the work? And what might the uptake be? What format should the self-management plan take on? Could we design it to be more inclusive to patients with a learning disability? Could it be rolled out over the whole of Nottinghamshire and possibly nationally to standardise COPD care and improve inclusivity? Next slide. Was it worth the effort? We felt, by looking at the figures, it was worth the effort of going through 18 months of real hard work, trying to coordinate diaries and work with Laura to make sure she had a big input in this care plan. COPD reviews in the community setting, when I've worked in GP surgeries for respiratory clinics, it was noted that patients with poor literacy, we have quite a high prevalence of poor literacy across Mansfield, and patients that were given this standard self-management plan weren't able to read the plan. A lot of patients didn't turn up for their COPD reviews because they couldn't read the text messages they were getting via invites. So a lot of our patients were exempt from their annual reviews, and it wasn't chased up for the reasons why they weren't attending. Patients with learning disabilities, we found, were often overlooked with the standard documents. This excluded them from being able to self-manage and feel confident about their COPD and make their own decisions. Next slide. So what might the uptake be? As given the figures previously, we could potentially target over 1,000 patients, over 1,500 patients, maybe more if we included learning difficulties and patients with language barriers, and even dementia patients with mild cognitive impairment. Next slide. Thank you. So we had to look at the format of the plan. And what it was really important to myself and Sarah was that the plan didn't look that much different to the current one, because we didn't want patients that were given this plan to feel that they were different from the patients using the other plan. So we didn't want a label on the front of the plan saying learning disability COPD plan. We just wanted it to have my COPD plan on the front, so we could broaden that out to a vast array of patients, and not just learning disability patients. However, that it was essential that we targeted the group that we wanted to give this plan to, and allow them to utilise it. Next slide.
So we started thinking about how we were going to go about it, which is again half the battle really. So we knew we wanted to include Laura and other people with a learning disability, to give feedback on any symbols, any pictures that we had. We went through many symbols and pictures until we got a consensus that it was right. We worked with speech and language therapy within Nottinghamshire Healthcare. It was really helpful, not just providing some of the symbols, but also doing some bespoke symbols for us as well when it wasn't quite right from the feedback that we got. We want to think about the colours, so it's important for us to keep the green, amber and red, again very recognisable. I noticed in the plan previously that from the previous talk that was used there as well, so something well known. We wanted to make sure the font was right, the size was right, but we wanted to keep it as a bifold leaflet that looked the same as the other leaflet to all intents and purposes. A lot of work went into getting this bit right and the right words to go along with the symbols as well. Lots of things like the colours of the inhalers that people use, so not just saying inhaler, just having a box with colours on and things that people could tick which is theirs. Just really important. Next slide, please. We went through, I know we've put 3 drafts on here. We went through multiple drafts. This actually wasn't our first draft. The one that we sent was very different to this. And then when it came back from comms from the designers, they changed it to blue, they changed the font, they changed everything. It was unrecognisable. This is what they sent back. I was like, no, it needs to be yellow and black. So we went on to then another draft, next slide, which was nearer, and we worked through that. And then the next slide is draft 3, but it's still not the final one. So the final one can be seen. This is nearly the final one, but it doesn't include the pictures for the using inhalers correctly. And you can view the correct one by using the link and the code that will come later. So as you can see, we kind of went through lots and lots of work, lots of drafts, lots of different things to get there. Next slide, please.
So we wanted to know how we could roll this out. We provided team updates for the GP surgeries, ensured all COPD reviews are inclusive and patients weren't just excluded from their COPD reviews for multiple reasons. When I worked in surgery, patients were, I'm saying excluded, they were marked as they didn't attend, or they couldn't take part in the review because the information provided the patients wouldn't understand. Some didn't get text messages. If they did, they couldn't read the text messages or the invite letters. So they DNA'd a lot of appointments. Poor literacy, language barriers were taken into account at every review when we worked in surgeries and rolled this out, and made it really important that although it was for learning disability patients, it was for more patients than learning disabilities. So we could include a larger amount of patients. We provided updates for the community services, including offender health. We've had some really positive feedback from offender health, saying a lot of their patients they have admitted with COPD are given both plans, the original blue one and mine and Sarah's new one, and they're over 90% of patients admitted are choosing the new plan. So it's gone down really well in offender health. Look to have the respiratory teams, the respiratory consultant and the learning disability team back in the rollout across Nottinghamshire, which it was. I work closely with our respiratory consultants in Kingsmill Hospitals, our local hospital. We've got a really enthusiastic team of respiratory consultants and respiratory nurses who have rolled this out for us in secondary care. The Association of Respiratory Nurse Specialists have been notified and written a paper on the new plan. Asthma and Lung UK are aware of the new plan. The Queen's Nurse Institute have been notified and did a lovely write-up about the plan. And then we appeared on Nottinghamshire TV that was so nerve-wracking to talk about the plan and let everyone know that it is out there and it's accessible for everyone to download and start using with the patients. Next slide, please.
So just onto a bit of feedback. So we had some feedback. Can you just press it again, Alison, please? From the respiratory team, a lot of them are just using this plan now. Why do we need two plans when one size fits all now? Really does one size fit all. So they're using that. And then we had one from Laura's home team. It's been essential for them because it means that with her pathological demand avoidance that she can be more autonomous. They use that, so they'll say if she's poorly, they'll say have a look at your plan, what do you think needs to happen? And so she's saying, I think I need my inhaler, or I need to do a sputum sample and send it in, rather than them dictating and then them finding resistance from her. So it's been really good, and she's actually had no hospital admissions since having the plan herself. She's been able to manage things much better. And then most importantly, what does Laura think of the COPD plan? So next slide, please. So a glowing review was, well, I'll let you read that for yourself. Yeah, that's what she thought of it. But the important bit being that it's in a handbag and that she does check it to see what she needs to do if she's poorly. And she does like to say thank you to Hiedi, but not Sarah, because she absolutely still hates me sending her into hospital. So that was her. But I think the fact that she's had no hospital admission since having the plan has been, great. Next slide, please. So this is just where to find the link, where to find the QR code. And that's us, really, unless there's any questions or thoughts.
And we'd like to hand back to Alison. Thank you.